In Medical Matters today, a treatment that works for horses is showing promise for people who have wounds that won't heal. That's a common problem for people with diabetes when poor circulation slows healing and can lead to life-threatening complications. 13 Wham's Jen Markham tells us about this therapy and an Irondequoit man who has seen it work for him.
Rick Jambrone had a softball-sized hernia removed from his stomach last fall. Partly because of his diabetes, the wound just wouldn't heal even after close to a year.
I was getting to the point I didn't know what to do anymore. It's just, it was scary that I wasn't closing up, and it was just, I was feeling, I don't really know what I was feeling. I was upset.
But then Rick agreed to be part of a clinical trial at Rochester General Hospital, where surgeons shone specific wavelengths of light into the wound. After just a few weeks, the wound finally began to close.
Light in the red wavelengths and in the near-infrared wavelengths, when delivered to tissues, actually helps kickstart them, if you will, and it stimulates the cells in the wound to start to grow.
Since low-level light therapy is a relatively new procedure, there are no devices for it. So researchers here at Rochester General Hospital had to improvise, using devices from NASA, from those used in muscular care, and this was a wound care device used on horses. Even though the treatment takes only a few minutes, patients do have to visit the doctor 4 days a week for up to several months to receive the dose of low-level light. If the clinical trial continues to be successful, RGH researchers hope their work will lead manufacturers of low-level light devices to seek FDA approval to use them on wound healing. Jen Markham, 13 Wham News.
Rochester General is seeking patients with troublesome wounds to participate in a clinical trial using that light therapy. If you or someone you know is interested in taking part, you can call the Rochester General Hospital Laser Center at the number on your screen, 922-4505.